Thank you so much. Good morning, everybody. Special thanks to Erica and Natalie for inviting me here today to speak about open data and specifically the Health Data New York site. I always have this problem, I'm sorry. Can you hear me better now? Okay. I'm sure everyone in this room has probably heard somebody say at some point, if only I could get my hands on that data, I could do this, this, and this with it. And I know I've heard that many, many times, especially now that I have been involved in Health Data New York. And the reason is obvious, because data is valuable. Data is the cornerstone to research, analysis, innovation. It's used to inform public policy, interventions, and it's also a way for individuals to make informed decisions. And so data, in essence, touches our lives hundreds of times a day and many times across, different ways that we interact. It's not always easy, though, to get access to data. Over the years and in general, public access to valuable state health data has not always been easy, and there is a variety of reasons for that. For one, it wasn't long ago that data was still in filing cabinets under lock and key, and it took a lot of manual effort to get data out, to duplicate it, to share it. There are formal state data requirements for requesting data, FOIL requests, data review boards, especially for health data because we have to adhere to patient privacy. So depending on what type of data is requested, these processes can be very demanding on those who are requesting the data, as well as those who need to prepare the data for release. And for state agencies, sharing data, even among employees within a state agency, is difficult. There's many silos that exist between different departments, and also because of that, there's data silos. And so as much as technology has greatly improved over the years, it also has led to barriers with data exchange. And not everyone has the same type of software and business intelligence tools. And so there's a very hard, sometimes people have difficulty being able to access data because of a formatting issue between these different types of software and business intelligence tools. And finally, it's natural to be protective of data. Sharing it means that you give it up, you give control of it up. And that can be very scary to folks when they have to do that. But why can't we make it easy? Why can't we release data if we know we have it and it's available to those who really want it and need it? This was the question our State Health Commissioner, Nirav Shah, who I think is here somewhere, said when he first took over the helm at DOH. Being a researcher at heart, he understands the value in health data and knew that the New York State Department of Health was sitting on a wealth of information that could be shared if we found a standard way to do so. And we dedicated ourselves to making it happen. Commissioner Shah, who I consider an open data visionary, believes that the strategic utilization of data combined with the engagement of external partners and stakeholders will lead to targeted healthcare policies and projects that will improve the quality of healthcare for New Yorkers. And so we pursued the commissioner's vision, and it was 2 months after he came to the department that the Metrics project was born. Metrics stands for Maximizing Essential Tools for Research, Innovation, and Excellence. The project's mission is to improve access to DOH's data assets and expand creative use of this data beyond government by encouraging innovation and collaboration. Important goals for the Metrics project include increased transparency and openness of government, provide data to consumers so that they can make informed public health choices, expand health research and policy analysis, inspire collaboration with valued partners, and drive health innovation through data. One of the first things we did to accomplish this was to review the data that DOH had. Then we decided what data could be easily shared and was appropriate, and if it wasn't already available, then we were going to make it available. In August 2011, DOH launched the Metrics Data Catalog, which made data available to the public in a way that wasn't done before. We started with just 5 data sets at launch. Just putting out new data publicly, we also went to great lengths to include metadata along with this data. So among our first data sets was the nursing home weekly bed census data. This data provides the number of nursing home beds available by bed category and occupancy rates in nursing home facilities statewide. And it can be utilized by family members who are looking to find a placement for a loved one. This data set is also an example of the first data sets made available to the public without a Freedom of Information request. Although our new metrics site was praised for increasing transparency and for leading the way in open data, for instance, the New York State Committee for Open Government, Open Government, referred to the department as a trailblazer in developing accessible open data sets. And in their 2012 report, they actually had a section about what we were doing at the State Health Department, which was really exciting for us at the time. But we knew that we wanted to build more, and we wanted to do something even better. So we wanted to mature from a simple data catalog to an open data site with more functionality. We wanted users to be able to interact with the data, download it in a variety of formats, visualize it, and share it. And after months and months of research, we found an answer in Health Data New York. The new Health Data New York site formally launched the department into the world of open data. And this is just a very quick screenshot of the website, and I'll get into more detail as I move along here. Health Data New York not only provides raw data, but allows healthcare providers, researchers, legislators, advocates, academics, and the general public to analyze and download valuable health data in a variety of formats. It allows users to review comprehensive metadata, create visualizations of the data, embed data, and other visualizations into the respective websites with automatic refreshes from the healthdata.ny.gov website. It also helps to users utilize application programming interfaces, or APIs, to build mobile applications and share data and visualizations through popular social media tools like Twitter and Facebook. Prior to this site, DOH did not have all of these capabilities in one platform. Health Data New York was launched on March 11, 2011 as part of Governor Cuomo's Open New York initiative. What makes Health Data New York unique is that with the official launch of the site in March, New York State became the first state in the country to create an open data site solely dedicated to state health data, excuse me. Health Data New York currently has a total of 176 data views, which includes data sets, maps, and other visualizations. We have 74 data sets, 24 maps, 74 visualizations, and 4 featured APIs as of today. New data is added to the site each month. In fact, we just released Child Health Plus enrollment data this week, as well as additional data regarding the New York State organ and tissue donor registry, and we have some others that will be going up very soon. Other highlights of the site include targeted public health messaging. This is created with input from our program experts, who I'm sure you'll probably meet today. It also reflects current events. If there's something that's happening related to public health and it ties into analyzing data to solve a problem, we try to make that data available on Health Data New York as well. Each data set is accompanied with an informative description of the data, and suggestions are provided to assist users on how to use visualizations. Oops, sorry. As I mentioned previously, through metadata that is provided with the data, it includes overview documents, data dictionaries, research questions, data collection tools, among other valuable information that's specific to each data set and can assist with the utilization of the data. On the technical side, each data set posted to Health Data New York is API enabled, like on Open New York, and it provides developers with the opportunity to use our data for the creation of mobile apps and other creative uses. And this is going to become very handy for us as we move towards December, and we're going to be hosting our first ever New York State Health Data Codeathon. And so lastly, all of our data is made available on Open New York, and it's also available on the federal open health data site, healthdata.gov. Here's a screenshot of the state's Open New York site, which also runs on the Socrata platform. Here you will find a variety of data from a large number of state agencies, as well as federal data from data.gov. Open New York is also, it also hosts local government data as well. And here's another look at Health Data New York, which you can also get to from the Open New York site. When visiting the site, you'll see that the main storyboards, they flash across the top of the screen, and they highlight certain data, and also our public messaging that we'd like to highlight at the time. Then underneath, there is a section to help users quickly see the site's featured data sets, as well as recently added data and what data is being viewed the most. This is a unique feature to Health Data New York. It's a first template that's ever been created with help from Socrata. And for each of those categories, users can scroll through the different data sets and can click on them from there without even accessing our data catalog, which is below. And it starts here at the bottom. We also have a Suggest a Health Topic button for users to submit feedback to us and also suggest potential data sets that are not currently on the site. After this feature, you can see the beginning of the main data catalog here, where all the data sets can be found. And you can also search the catalog by view types, data sets, charts, and maps. So what data can you find on Health Data New York? In my opinion, a good deal of valuable information is on Health Data New York, and I'll show you why. As I said earlier, there are 74 data sets currently on the site. Data sets range from food service establishment inspection data to managed care data to hospital cost reports, behavioral risk factor surveillance surveys, professional medical conduct board actions, to hospital inpatient discharge information. And that's just a very little slice of what's on our site. And this slide is representative of some of the data that's there. So I'd like to take a moment to highlight a few of our data sets that have generated a lot of interest since we've made them available on the site. Our food service establishment inspection data set, which provides inspection results for restaurants, school cafeterias, snack bars, and other establishments beginning in 2005, has caught the attention of Yelp. And Yelp has contacted us about using the data on their site, which was also pretty exciting for us to hear. When public health partners, academia, researchers, and others are asked what type of data they want access to in order to support research and analysis, they request hospital discharge data. And so for the first time, DOH made our statewide planning and research cooperative data, or SPARCS data, available without requiring a FOIL request. This data is comprised of inpatient hospital discharge level detail on patient characteristics, diagnosis, treatments, services, and source of payments for all hospitals in New York State. Our hospital-acquired infection rate data, which is reported by New York State acute care hospitals for various infections following surgery or other procedures, is not only used by the department to ensure patient safety, but it's also used by hospitals to implement or improve patient safety protocols. Patients also use this data to inform decision-making if they need to have a certain surgical procedure performed. And this slide I inserted here because if you were looking for a data set, and say you were looking for the SPARCS data set, this is how you would do it. You would go to the search feature in the data catalog on the left-hand side and insert the word SPARCS, and all of the related data sets that have SPARCS data in them appear for you. And you can click through each one, and it will give a brief description of what the data is, as well as provide you with the raw data. This is an example of what the data set would look like when you clicked on the data set to see the raw data. And this is the hospital inpatient discharges for 2011. And you'll notice on the right-hand side, you'll see a filtering mechanism to be able to select what exactly you want to see within the data set. This is an example of a visualization that was created to accompany this data set. And as I said, there are filters on the right-hand side. And you can see that we were filtering by years 2009, 2010, 2011, and 2012 for a variety of hospitals for inpatient discharges. And with every data set, you'll see at the top there's a basic description that you can click on, and it will give you a full background of what the data is and what it isn't. And if you look at the top buttons along the top, if you go all the way to the right, there's an About section button, and you click that and it provides all of the metadata that accompanies the data set that you're viewing. So one of the important features that Dr. Shaw insisted upon when we created this site was to include metadata and to make sure that we had as much metadata available as possible so that researchers or others, the general public, understood what the data is, what it isn't, how it's collected, the tools that are used, and limitations of the data, because that's very important to know. This is what it would look like if you were to download or want to download the Sparks file. And you can see here that we start to get into the metadata component here with some other additional information provided for you. This is another example of one of our data sets. This slide shows hospital-acquired infection rates for local hospitals by type of surgery for the years 2008 to 2011. And if you wanted to customize your search, you can do that by using the filter option on the right side. And so you can see we have Albany Med highlighted here. And then for the different types of surgery, you can see the rates by year. And this is a map of that same information. It just shows infections by hospital within the Albany area. And so if you wanted to see and compare the hospitals in a certain area, this puts a visualization to the data. And people obviously understand data in different ways, so we like to provide visualizations with all of our data sets as much as possible, and we like to include different charts or maps with that data. In May, we posted additional student weight data broken down by school district. This data captures the prevalence of overweight and obesity among students from 680 public school districts outside of New York City. We know that this data has already been utilized for research purposes among students and other community leaders, but has a lot of potential to be used in combination with other data to understand the health of New York's children. And finally, one of the first data sets made available to the public without the Freedom of Information request was, as I said before, our nursing home weekly bed census data. Again, another screenshot of what the student weight data set looks like and the results for local area schools. So if you were to look at this, obviously it's broken down by county, Albany County. The area name indicates the school, the region, northeastern part of the state, the school year, the number of overweight, the percentage of overweight, and then it continues on. Obviously, this is a screenshot, so I couldn't capture the full data set, but it continues and you can see the percentage. And it's very easy by the bar that's there with the data set to see how far some schools are with obesity rates and how others are doing a little better job with that. But it's important to realize that this data is not reflective of the actual school district. This is just the way that we're capturing the data to show that in this area, based on the data that's coming in from the schools that we're analyzing, this is what the data says about the health of children in these areas. And so that's one of the components that we really wanted to make sure was known when people analyze this data. And I'll show you the slide that accompanies this data set, the metadata that goes along with it. It's very comprehensive. And I'd like to thank Ian Brissett, who I'm sure you'll see here at some point today, as it was him and his team that put that information together, and it's very valuable. And this is another way of looking at the data from a statewide perspective. And you can see here that we're analyzing the district total and elementary school children, and as well as middle and high school student. And this excludes New York City. And this is, I apologize, it's a little blurry, but this is the actual all of the attachments that are included with this data set. We have an overview document. We have a benefits document explaining why this data is valuable. We have a data dictionary, research questions. So one of the things we wanted to facilitate with this data is if we do have researchers or students who are interested in certain types of data or exploring research, we wanted to say, well, from our perspective, from the state government perspective, these are some research areas that you might want to pursue. And so we've included those in our overview documents, and that is also something that Dr. Shaw insisted upon. Being a researcher himself, he felt that we should help students pursue research, and so we added that in. We also have direct links back to our program areas in the About section. So if you wanted to pursue other data or look at other programs that are related to this type of data and the work that we're doing at the Department of Health, you could easily go back and access it through this page. And then you'll start seeing some of the data set summary information here, the time period that it's collected, how frequently it's updated, who the data set owner is. So say you wanted to reach out and get a little more information. You know, these are the people, our experts in our Bureau of Chronic Disease and Evaluation and Research are the ones that are the data experts for this data. We also, it continues down, and any type of limitations to the data we'll note for you so that it's easy for you to understand that as well. And one of the other things that's unique to this data set that I just wanted to highlight is Ian and his team, as well as the Health Data New York team, decided that we should probably help people create some visualizations around this data because it's so valuable. And so they actually put together a guide on how to create visualizations using this data for the general public's use. So just very quickly, because I am running over time here, the New York State Department of Health is committed to fostering collaboration, developing meaningful partnerships, and pursuing and spurring innovation around health data. We continue to release valuable data. We're working towards creating public health dashboards so that we can understand the health status in our communities. We want to pursue collaboration, further collaboration with our federal health partners at healthdata.gov and HHS. We're going to expand to include other data from other New York State agencies because when you link certain data sets together, you get a better idea of the health of individuals and communities. We also are working towards developing a secure portal to provide accessibility for more restricted data. And that's one of the things I probably didn't mention, but all the data that's on Health Data New York is not restricted and it's de-identified. So there's no patient identifying information in this data. And then also we were going to use our data to support codathons and health innovation challenges. And as I mentioned before, and you'll see in your packets, we have some information that we provided to you about our upcoming New York State Health Data Codathon in December. And with that, I'll end. And if there's any questions that you have for me, I'd be happy to answer those.
Pat and George, can you join me? Okay, so we're going to open up the question and answer period right now. I don't think I have a microphone.
It's okay, we can share.
Julia Moore with the Pew Charitable Trust. Thank you for a very interesting presentation. I won't even ask what kind of technical challenges you faced in putting this together, but I'd like to ask what you think were the major policy challenges. Was it the elimination of the need for FOIA? Was it getting agencies who own the data to contribute? What were those hurdles? And I'd also include the de-identification. What were those hurdles and how did you overcome them? And a second part of that question, if I could, because my husband is a New Yorker, I'm assuming that what you're doing is the best in the country. And have other states come to you and asked you, how did you do it? And do you have a capacity to provide assistance to other states that, as my husband would say, might try to be as good as New York?
Yes, thank you. Those are great questions. When we started this process, it was a very much of a cultural change within the Department of Health. Because as I kind of alluded to earlier in my slides, we're just not used to just sharing data so easily and making it available in ways that we've never attempted before. And so it did take a lot of meetings and working with our program data owners for them to understand what we were trying to do. And it did help that we had some really great models at the federal level with data.gov and healthdata.gov to be able to say, see, this is kind of what they've started, and we can make it happen here in New York if we want to. And so it was very much establishing an approval process that we had to create that didn't exist before. We had to engage all elements of the Department of Health in all program areas, from the program data experts to our legal department to our public affairs group to the executive office. And so we really had to work, and we had to start from the bottom and work our way up. And we had to create a steering committee to be able to bring, the directors of our bureaus like Dr. Burkhead and others in to allow them the opportunity to work with us so that we can make the process as efficient as possible. And it's worked out really well. The process that we've established was actually kind of used in creating the process that's now used for all agencies for Open New York. And with Executive Order 95 that the governor issued this year, when we launched both sites in March, all agencies now have to make data available. And that's also a first, to be able to combine an executive order like that, which also does help for agencies to understand. And when we have a governor that's so supportive of transparency and openness and really bringing government to the people, it's easier for us to do that when you have backing at the executive level. And so we were very excited about that. And so the New York State Open Data Handbook was recently just released the first week in November. And that actually explains the whole process of how we choose data, how we get it ready, and then also what data we should be targeting. And what we found in the Department of Health was we just wanted to see, what did people want? What did they want every day that we weren't providing to them? And so one of the easiest ways to do that is to look at your FOIL request to see, who's requesting data over and over for the same things. And so, like I said, the nursing home weekly bed census was one of the first data sets that we identified off that list to make available. And then Sparks was obviously another. And so that's one way of approaching it. But it's also talking to the program experts and saying, what data do you think is valuable that people outside of the department really could use to support research or just to make personal health decisions? So it was a very much of an engagement with them as well. We did an inventory within the department to see, what data we could make available. And obviously there's some that we just will not ever be able to make available for privacy reasons. But so in that regard, we started in 2011 and we're here in 2013, and this is where we've gotten. And we wouldn't have gotten here without the help of the whole department. So yes, it was challenging at first, and there still are challenges because the more data you put out, the more you have to think about how data can be linked. And then that also requires an analysis of the data to ensure that, we are following HIPAA requirements. But again, I think what we have established in the department is working really well right now. And we have been contacted by other states, Louisiana, Chicago, California, Ohio, South Carolina. And they've also asked us, how did we do it? Where did we start? And my first answer to that is, well, it just started with a vision. It just started with us saying we want to be more responsive to New Yorkers. We want to get health data out there so people can make better health choices. And then eventually the policy and targeting interventions within communities will follow once we can get it out there. And so we look to them, and there's stuff that we can learn from them as well, from their challenges, but then we also meet with them. We've had numerous meetings at Health Data Palooza last year, or this year in June. We had a lot of dialogue with other states about certain things that they were doing. There are certain states that are hosting codathons, but they don't necessarily have an open data platform. So we are kind of exchanging ideas about, well, how did you do your codathon? Well, how did you do your platform? And so, yes, it has been very interactive, and we've gotten a lot of good ideas from other states, and we've also been able to provide the Open Data Handbook to them, and then as well as just walk them through, like identifying the resources that you would need, and also saying maybe you can have your governor issue an executive order as well, to really kind of bring this to the forefront.
Excellent. And the other gentleman over here? Just wait until, you can come across this way, Carrie.
Okay.
Yeah, sorry. Just.
My name is Kajal Lahi. I'm an economist at SUNY Albany. I just want to ask one question. You have, it's commendable, you have put out a lot of different data sets. In the process of doing that, particularly metadata, have you matched any particular data set with another data set at individual level? For example, have you tried to do like vital statistics records with the Sparks data, or BFRS's data with vital? Have you tried to do, because that's the most sensitive part of doing it, at individual level, it's highly sensitive, but from a research standpoint, it would be great to have some of those data sources merged, and you can only do that rather than somebody else doing it. Mm-hmm. You understand what I'm saying?
I think so. We haven't actually formally,
Stay tuned.
It's coming, right?
Stay tuned. In preparation for our codathon, which is being sponsored by the New York State Health Foundation, and we're really thankful for that. We are putting together some community health indicators, and what Dr. Burkhead was talking about with the prevention agenda, that's the next level of data. And we're working with his team to get data out on obesity, diabetes. Those are the two to start with, and I think there's 38 other health indicator groups. And it is a mixture of just those data sets that you mentioned. So that's where we're going. That is a harder challenge, but stay tuned.
And I think just to follow up on that, in conversations we've had with this team, Tania, can you give a sense of when the idea pops up in a head somewhere, the time frame it takes from that idea to publication on the website? Because with all the safeguards and the ways that they're trying to mitigate some of the issues, it can sometimes take a while still. So.
Right, depending on the nature of the data set. But on average, it takes about 2 to 3 months to get a data set up on our site, just one. And that's because we have to do the rigorous protocols of reviewing, de-identifying, making sure that we've, analyzed the data from all different perspectives to make sure that it's in the form that we want it to be in before we put it on the site. And then, like baby names, for instance, we do have baby names on our site. That did not take that long. But the Sparks data set, it actually took us a year to get the Sparks data set up.
Thank you. I think we have another question back there.
Excuse me.
Ellen Lee from Stony Brook. I just have a very practical question. I'm very intrigued about the obesity and diabetes initiative. What is going to be your data source?
It's really a variety of data sources from the vital statistics, Sparks, the behavioral risk factor surveillance survey, and many other sources. Over the next 2 to 3 weeks, please look at our most recently added button, And all those data sets will start coming out to you. Some of them are just information that the different program areas put together specially for the Codathon. And we're also going to have an innovation challenge that was also sponsored by the foundation in early 2014.
And just to follow up on that also, our afternoon session is devoted to finding ways to provide input to the Department of Health on what kind of variables, what kind of data do you need that you need to do your research. Can it happen? Possibly, but can they release it? Possibly. Can they not? Maybe not. But it's providing that kind of input is really what's going to help them understand different users' needs. So that's reserved for these afternoon sessions. So that was a great question. And before, I just want to make sure no one else has any other questions. Tom, and we'll come back to you in the second. Terry. Sorry. Oh, we got a couple over here. Okay.
Yeah, Tom Gaze, Rockefeller Institute. Well, before Courtney Burke actually abandoned us, she did a really nice study using administrative data from the Department of Health, and she found some differences across counties with Medicaid eligibility information that were, to put it mildly, inexplicable. And it was actually a very useful study because it sort of suggested that there are problems with the data and the way the data were coded, managed, et cetera. And I wonder, are you finding that as you're going through this process of preparing data or releasing it? Is this transparency actually feeding back to ways of dealing with a lot of the problems we usually see administrative data, missing information or inconsistent codes and other kinds of problems?
Yes, we have in our process found a number of data sets that when we looked at them in the way that we needed to make them available on the platform, it was very obvious that we were missing large pieces of information, or it wasn't presented in a way that it should have been presented, and it was misleading in certain cases. And so that's an added benefit to what we're doing, is to be able to identify those issues when we see it in our data sets. It's been very helpful in that way.
Yalini Sanathiraja from SUNY Downstate Medical Center. The previous speaker mentioned democratizing software, which happens to be my area of research, but I'm only aware of individual computer scientists and companies that seem to be working on that. Are there sort of state initiatives about that specifically?
You know, I think we would probably defer to the Office of Information Technology Services for that question. I know that they are doing a lot of work in that area. From our perspective, you know, it's an open data platform, so, you know, it's available to everybody.
I think I was talking more about the usability aspects, you know, for ordinary people who aren't researchers and so on.
Okay. Well, I think what we try to do with our site is we try to present the data in a number of formats, from Excel documents to CSV and in other versions, so that people who might not have that software available to them could still access the data. And that's built into the platform.
Any other questions? I have one too, just because it was mentioned. You mentioned a number of great initiatives that could possibly use this kind of data in the classroom from multiple levels of education. Can you talk a little bit about how your obesity data has been tried to be used in school districts throughout New York State?
Yeah, we have gotten some feedback from certain individuals within our program areas who have said that our data set has been used in the classroom to analyze obesity rates and to also educate students that this is what's happening, you know, here. You need to, you know, think about, you know, exercising more, eating better. and definitely reinforcing healthy habits. We also know that our data was used to inform some parent conferences and school conferences to see about the menus for schools and how they wanted to change the menus to make it more healthy to help their students. And then, of course, the media loves this data set. And especially, we got a lot of press in the western part of the state when it was first released. And the western part of the state has some difficult challenges regarding obesity and diabetes. And so I think that's the reason why the media picked up on it so much. But yes, I mean, the media definitely follows what we're doing, and they definitely, embedded our site into their website out in the western part of the state. And so, people were able to go right directly to our site and get this data. So in that regard, but that's one of the things we really do want to learn more about from the research community, from academia. What research are you guys doing right now that you could utilize this data in a way that maybe we don't know about? We want to be able to tap into those different types of resources and collaborate with you to see if maybe we can even make it better. We would love to have students to be able to go to our site and use our data, because that is one of our target audiences, is to support them too.
That's great. And in your packets, we started to construct a how to use open data in the classroom, sort of just a commentary really, but we want to continue to expand that, because I think these are really excellent resources, whether with it's the visualizations and consuming data as students, working with raw data sets, and then you all as working with the real raw data sets. So that's great. Any other questions? Oh, we have one in the back.
Hi, I'm Matt Jacobs. I work down at NYU, and first off, thank you for the presentation. I think it's really interesting work that you're doing with
Welcome.
Giving out the open source data. You really enable the private sector and the developer community, entrepreneurs, to really operationalize this data. My question, I guess, kind of piggybacks off of what Tom had said about disparities within data sets. Are you or your organization taking any efforts to standardize the collection of data?
Yes. We have an ongoing effort in the department to do that. It's a very large process to undertake, as we have a lot of data in the department. But yes, I mean, that's one of the things. When we first were going through our inventory to see what data we had, we really didn't have a way of saying, well, this data is considered level 1 data where it's unrestricted, and then this data is considered more restricted, but if you use a data use agreement, then you could put it out. Or this is completely top, sealed data that you cannot use. We never had anything off the shelf that we could just apply to our data. And so that's one of the things that we're working on in the department and this project actually started that thinking. And so we have such a variance in how data is collected as well that we have to take that into consideration, why it's being collected in a certain way. Who's it going to? Is it a federal requirement? Is it a state requirement? Do we give it to counties? Is it coming in from counties? It's very involved, but yes, it's underway.
If I could add to that, I think through our overview documents and our data dictionary, when we sit down with our program data owners and go through each of the data elements that they are putting up on Health Data New York, that's where a lot of interesting questions are raised. And that's where we start seeing the need for maybe additional data elements to truly explain what the data is. Or maybe when you look at it up on the screen for the first time, because the operational data is usually in a very different format, and it's not as visible as up on Health Data New York. And when our program data owners see it up there, they say, ooh, I got to clean that up before this gets released. So that's why it does take us 2 to 3 months to a year. We have one data set, 2 years. We go through a very strict quality assurance process with our program data owners and legal. And there's a lot of program data owners in the room here today, and I want to thank you so much for all your efforts, because it is a heavy lift, and they are the ones that do it. They are the ones that pick the data. They are the ones that work on all that metadata, so thank you.
And I think that's an excellent point to end on right now. So can we please give our panelists and Tania a round of applause for really excellent